ABC for Health is a nonprofit public interest law firm in Madison, Wisconsin.
Since 1994, ABC for Health has helped people navigate the healthcare coverage system.
Through a policy investigation, ABC identified the systemic harm brought on by the policy in Wisconsin known as birth cost recovery. It is a policy that disproportionately affects unmarried minority families in poverty and may deter young pregnant women from obtaining prompt prenatal care.
For years, ABC advocated for change. Ideally, elimination of the policy or, at the very least, increased discretion by child support agency legal staff when seeking birth cost recovery judgments.
ABC needs help to promote sustainable change in birth cost recovery policy. As a community, we know we can do more. We need to do more.
That is why ABC for Health collaborated with HealthWatch Wisconsin and 13 other community-based organizations to raise awareness, develop a policy report, and publicly illuminate the practice of birth cost recovery around the state. Because after all, knowledge is power.
For years, county-based child support agencies have used the talking point that birth cost recovery judgments support children and families. This is simply untrue. Instead, child support agencies have a perverse incentive, referred to as the county bounty, where they pocket 15% of all payments for mostly low-income minorities and other disparity populations. It's not child support.
Our research found that between 2011 and 2016, Wisconsin collected nearly $106 million in birth cost recovery judgments. Unlike child support, however, not a single nickel of those collections went to support Medicaid-eligible moms and infants in need. Nearly $16 million went to child support agencies, and the remainder went to the state and federal government. It's not child support.
Our research indicates that birth cost recovery may increase infant mortality. Wisconsin's black-to-white infant mortality ratio of 2.9 is among the highest in the nation. It's not child support.
The unintended consequences of birth cost recovery are perpetuation of family poverty, contribution of parental discord, lack of paternal support, increase in chronic stress, and delayed entry into prenatal care. It's not child support.
Excessive birth cost recovery judgments negatively impact child support payments. Birth cost recovery judgments compromise the resources from financially strapped dads that could otherwise be used to support the family. Strong enforcement measures by child support agencies often do not result in increased payments, but instead keep fathers from participating in the system. It's not child support.
Judgments make fathers less likely to take an active role in their child's life. Birth cost recovery judgments can become 30% of an under or unemployed non-custodial father's income. The fear of inability to pay, the potential for court action, contempt of court charges, and loss of a job can act as incentives for fathers to disengage and run. It's not child support.
At the very least, the weight of obligations associated with birth cost recovery can cause family conflict and can keep fathers and precious financial resources away from families and children. It is not child support.
We can work to systemically challenge birth cost recovery on a policy level while we educate low-income families about their legal rights and how to protect themselves against birth cost recovery.
The funds will support education and outreach to better inform and protect women, children, and families against birth cost recovery judgments.
Please support our work because ultimately, it's not child support.
It's not child support.